this set of slides, we're going to deal with mood disorders. I'm also going to be talking about some other miscellaneous disorders that don't fit neatly into any of the other categories that we've been discussing. The most common kind of mood disorder is probably something known as seasonal affective disorder, which has the very appropriate acronym SAD. An individual suffering from seasonal affective disorder discovers that during the winter months, when daylight becomes less frequent and it's just kind of dark and cold, they start to feel lethargic. They aren't interested in social life very much. They just want to sleep a lot. They tend to overeat. There's very little energy for doing much of anything else. This can continue for quite a while, but as the season begins to change, or even on the occasional bright sunny day, the person might notice a lift in their spirits and mood. And when spring rolls around, the disorder completely goes away, perhaps only to return again the following year. Some individuals don't even know that they're prone to seasonal affective disorder until they move to Alaska or some other far northern place where suddenly they discover that they struggle a bit in the winter. Seasonal affective disorder can be treated with a technique known as phototherapy. There are many different types of lights that a person can buy that simulate the light that you get from the sun. And spending a couple of hours in front of these lights seem to be very helpful to people. The picture you see on the slide is an example of one of these lamps. Another very common mood disorder, and one that's much more serious, is something known as bipolar disorder. A person experiencing bipolar disorder vacillates between two different states of being, mania and depression. When the person is in their manic stage, they feel great. They have a tremendous amount of energy. They're hyperactive. They have all kinds of wild, exuberant, unrealistic plans, grandiose things that they're going to do. They can be intrusively social. They think that everything is possible, and they sometimes engage in some very maladaptive behaviors during this time. For example, they might go on spending sprees and max out all their credit cards and get deeply into debt. Or they go on sexual binges where they're sleeping with all kinds of people, and then afterwards there are all kinds of repercussions from that as well. So the person in the manic stage is feeling great but doing things that aren't so great, and then all of a sudden they crash and they sink down into a very deep depression. And then it's just the opposite. They have no energy for anything, no interest in anything. They ruminate and reflect on all of the awful stuff they did during the manic phase. And then eventually they'll cycle back into the manic phase. Most individuals respond pretty well to drug treatment with a drug called lithium. One of the problems is getting people to continue to take it, because apparently when you're in the manic phase, you feel great. The energy, the sense of well-being, the optimism is something a lot of people don't want to give up. And therefore, while they're in that phase, it can be hard sometimes to get them to stay on the medication. But they need to do that, because otherwise they're going to slip right back into depression, and the disorder just continues. It doesn't get better. Many people suffer from severe depression, where they don't vacillate back and forth. They're just sad and depressed all the time. They don't care about anything. They feel worthless, and they have no hope for their futures. They withdraw socially from their friends and family. They're tired all of the time, but they can't sleep very well. And all the things that used to give them pleasure, good food, good sex, just going out with friends, none of that has any appeal. Their activity level just becomes very low. In extreme cases, these individuals may even suffer from delusions of some sort. For example, they might actually believe that their internal organs are rotting away, and this can cause, of course, all kinds of serious problems when you become obsessed with thinking like that. The biggest risk of severe depression, of course, is that this is the time at which people might commit suicide. The hopelessness about the future, the lack of worth one feels about themselves can be a very dangerous thing. So somebody exhibiting the signs of severe depression does need help for sure. Now, there are a lot of different causes for this. Part of it is just faulty thinking. The person has unrealistically negative ideas about themselves. They spend a lot of time ruminating on their shortcomings, on their past failures. They blame all the bad things in life on themselves. And this type of thinking can be dealt with through cognitive therapy, but it appears that there's also a genetic predisposition in that people who have a history of depression in their family may be more likely to experience than people who do not. This disorder is more common in women than it is in men, but I'm talking about severe depression here. Bipolar disorder is equally common in men and women. There are a variety of ways of treating depression. Obviously, you can take drugs, antidepressant medications to lift a person's mood. Some people respond well to cognitive therapy, where the therapist challenges the way they're thinking about themselves and their lives. But in extreme cases, the person may be sent to electroconvulsive shock therapy, where an electrical current is passed through the brain, inducing a seizure. And for some reason, this lifts the person's mood. It gets rid of the depression in most of the people, at least for a while. Now, this is obviously a treatment of last resort. It's not something you do unless the person has not responded well to medication or therapy. But it's a fairly routine, not very dangerous procedure. There are a couple of videos with this module that you probably should look at. One of them is a simulation of what an actual electroconvulsive shock therapy session looks like. The other one is a clip from the movie One Flew Over the Cuckoo's Nest that shows how it was unrealistically and terrifyingly presented in movies traditionally. So ECS does work for most depressed patients, but it is the thing you try last. Here is a brief list of some other disorders that are very common, but they're not psychoses, they're not neuroses, they're not mood disorders, but they can be problematic nonetheless. Substance abuse disorders are just what they sound like. The person has an addiction problem, whether it's to alcohol or some other drug. Substance abuse disorders are more common in men, especially the early onset varieties that occur relatively early in a person's life. Impulse control disorders. A person has an intense drive. It's like an itch that has to be scratched, that they need to get rid of it. And this drive can only be eliminated by engaging in an impulsive kind of behavior. So gambling, pyromania, the setting of fires, kleptomania, the stealing things just for the thrill of stealing. These are all examples of impulse control disorders. Disorders that are in some way connected with a person's sexuality are known as psychosexual disorders. Gender dysphoria occurs when the person essentially feels trapped in the body of a different gender. They don't identify with their biological gender. Their psychological gender is at odds with that. Paraphilias. Paraphilia is just a fancy name for a fetish, the kind of thing that turns you on. And whether a paraphilia qualifies as a disorder or not depends upon a lot of things. Is it causing trouble for the individual or for other people? If not, if it's just sort of this innocent thing and they have a willing partner, no problem, no disorder. But sometimes you have a paraphilia that will cross cultural boundaries, lines that society has deemed something that you just should not be doing. Pedophilia, for example, zoophilia, having sex with animals, necrophilia, having intercourse with dead bodies. These are lines that one does not cross. In those cases, it's almost always diagnosed as a disorder. Sexual dysfunction is anything that prevents the person from having an enjoyable, normal, healthy sex life. And if this is causing trouble in a person's life, they may seek help for that as well. Probably the most difficult one to deal with are personality disorders. Personality disorders are things like narcissism and the dark triad personality traits that we talked about earlier in another module. These individuals are exploitative. They are not emotionally sensitive to other people. They have no remorse, no conscience. They lie, cheat, and steal to get what they want. They may be superficially charming and friendly, but they aren't. They're manipulative and cunning and often highly intelligent. And these people seldom seek treatment on their own. They usually are forced into treatment by others with whom they've had unpleasant run ins. So, not surprisingly, people suffering from personality disorders are much more likely to run into trouble with the law, get arrested for all kinds of illegal activities, and even on a more mundane everyday level. It's a real unpleasant thing to be involved in a romantic or close personal business relationship with a person with antisocial personality. This slide just provides a visual to remind you what the dark triad personality traits are: narcissism, Machiavellianism, and psychopathy. I'm not going to talk too much about those because you learned all about those in the module on personality. And here's yet another visual reminding you what the dark triad personality traits are.